Hello, I am Amy Turner, and I am a current patient of the Mayo Clinic for the bariatric program. So I'm really just here to tell you my story, and hopefully it will help other people. When I came to the Mayo Clinic, I was 43 years old, and I have been fighting my weight my entire life. It's actually something my whole family has been fighting. And it wasn't that my parents didn't try, it wasn't that my family didn't care, it's just they had really bad habits and I had to relearn habits. So what was really scary to me was I moved from Seattle to Arizona. I left my whole family. I left my entire support group, and all of a sudden I'm in Arizona and I gained about 40 more pounds. At my highest, I was 336 pounds. And I started having issues with my blood sugar, and that really scared me. My father passed away, and it starts with diabetes, went to congestive heart failure, and I was actually following his same path. And it's kind of a family joke that I was my dad except for the plumbing, and so that really woke me up. When I started having the blood sugar issues, it petrified me. So I called my family, and I talked to him about it. I said, this is something I'm really thinking about doing, and I was very lucky. They were 100% supportive because they know that I have tried everything. If you name the diet, I have tried it. I can just go on and on and on about what I've tried, and I was always unsuccessful. And that's really hard for me because I am a very successful woman in my career. But personally, I kept struggling with my weight, and I felt that it was my one failure. So here I am thinking I'm going to end up like my dad and die very young. And that was very hard for me because I didn't want to do that to my family. So I started looking around, where should I go? I went to a number of places. Mayo has a wonderful reputation, so that immediately piqued my interest. So I called them up, and I got scheduled into a what do they call that? It was just the initial meet and greet. You got to meet a doctor, you got to hear about the program, what is the process. And so I thought, okay, and remember I've done this with quite a few other companies, so I came in one night after work and Dr. Harold was there. And I immediately connected with her. I mean, what a phenomenal doctor. I had some questions. She answered those questions very matter-of-factly, no judging. And as an overweight person, you get a lot of judgment, and that's it's very hard. So there was no judgment. She was very matter-of-fact. So I decided, I said, you know what, this is the place I want to go. And so I started the process. Mayo they make sure you're ready. So you go through the process, you see the therapist, you have to write everything down, what you eat, what you're thinking when you're eating. You read this wonderful book on mindful eating. Read that book a couple, 3 times. It is phenomenal because really we don't think when we eat. So, read that book. You go through the change classes. You meet with the therapist. She goes over your food log, and then then they have to all meet, and then they say, yes, Amy is ready for surgery. When that happened with me, I was scared, actually petrified, but very, very, very happy, because this meant that I was going to have the best tool to help me get healthy and live in pain-free. I did it for my family and me. I'm a firm believer I have to do it for me, but my dad, God rest his soul, he didn't want me to follow in his footprints, and my mom and my sister, I love them more than anything. And watching them watch me be so unhealthy was very painful. So now, like I said, my sister and I did the bike ride. We're now looking at another bike ride, maybe a 400 or 500-mile ride. We're thinking about doing, something that will keep us both going in the right direction, because we both have always fought with our weight. Research all the companies you go through, and I truly believe you will choose the Mayo. The main reason is because they give you the training, they give you information, knowledge up front. Then you have the surgery, you have all the support around you. And then for the whole next year, you meet quarterly, get blood tests, get everything to make sure all your blood work is in line. I just want people to have the tools that I had and more, to help them make this decision for their lives.